Good morning, everyone, and welcome to the 6th Diabetes webinar series of our RAC Diabetes Challenge 2022 program. Diabetes disease is on the rise worldwide, and it is caused serious complications in our body if left unmanaged. The disease is mainly caused by family history, inappropriate diet, lack of physical activity, and sedentary lifestyle. With RAC Hospital's commitment to the community and the people of Ras Al Khaimah, RAC Diabetes Challenge 2022 is organized. The program includes a series of diabetes webinars on diabetes management, which provides comprehensive information on the medical aspects of diabetes, advices on therapeutic diets, exercise, stress management, and many others. We certainly can help reduce our risk of getting diabetes by maintaining our ideal weight, being active and fit, and eating a healthy diet. Today, I am very pleased to introduce our expert health coach, Dr. Madhurima Deshmukh, to give us insights on diabetes management and the role of lifestyle factors in our health. Dr. Madhurima did her BHMS in year 1992, completed postgraduate diploma in preventive promotive healthcare and fellowship in lifestyle medicine from AHERF. She is an accomplished diabetes educator from International Diabetes Federation and became certified fitness trainer. Dr. Madhurima holds 20 years of experience in the field of health and wellness. She worked with Lifestyle Wellness RX Apollo Hospitals, Indraprastha in New Delhi, RAC Diabetes Center in Dubai, and Arabian Wellness and Lifestyle Management, UAE. Currently, she is associated with Mommy and Me Pregnancy and Lactation Clinic in Dubai. Dr. Madhurima is well experienced in health risk assessment, health counseling, health talks, and group fitness sessions. Her focus are on health and wellness, weight management, exercise programs, nutrition, stress management, pre- and post-pregnancy fitness, and diabetes education. Let us all welcome Dr. Madhurima Deshmukh.
Hello, good morning, everyone. I hope you can hear me. Hello. Hello.
Yes, doctor, we can hear. Yes, doctor, we can hear.
Okay, thank you so much. Thank you, Ms. Liling, so much for this lovely introduction. And thank you, RAC Hospital and Arabian Wellness for giving me this opportunity. So today I will be talking about diabetes and how we can take care of it through some lifestyle modifications. So I will just share my presentations over here now. Okay.
Yes, doc, we can see.
Okay. So as we all know that diabetes mellitus has become, is a rampantly growing disease worldwide. Millions of people have affected, and still each year many people are getting more and more newly coming into this category of diabetes mellitus. It has become actually a global, it is affecting global health actually. So and the situation is getting worse and worse, but this should not be a scenario. If we all work together collectively and each person takes ownership of his health, and then together with the lifestyle, with the healthcare systems, we can very much contain this modern preventable pandemic. So that is what I will be trying to say here, that how we can manage this disease by some lifestyle modifications. So today let us see what is diabetes, its types, and what modifications we are talking about and how we can go about it. So what is diabetes? So diabetes is nothing but whenever there are excess level of glucose circulating in the blood, it is called as diabetes, diabetes mellitus. When we eat food, the carbohydrates from the food are secreted into the blood and as glucose. And this glucose helps the cells to use it as an energy. So each cell needs energy in the form of glucose. But to happen, this is not just a clear cut, easy solution. There is one mechanism acting. That is the beta cells from the pancreas, they secrete insulin. This insulin acts on the cellular membrane. There are receptors. It opens those receptors, then only the glucose can enter into the blood cells. So this is a safety mechanism. So if there is something goes wrong in this mechanism, then the problem of diabetes mellitus occurs. So there could be a problem with the production of insulin, or insulin is there, but there is a problem with the cellular resistance, or the cell is not absorbing the insulin as it requires. So depending on this, there are some types of diabetes. So type 1 diabetes is where when there is a problem with the insulin production. So the body attacks its own cells, its own healthy beta cells, and there is a less production, or there is no insulin production at all. This leads to diabetes. In type 2 diabetes, insulin is produced, but it is getting registered from the cell and the tissues. And then eventually there is a fatigue of the beta cells, and the insulin productions also start to decrease. This leads to diabetes mellitus. Then there is a gestational diabetes, which occurs in the pregnant ladies. This is due to hormonal changes, and also overweight, obesity also plays a role in this. Then there is a category of pre-diabetics. Pre-diabetes is where there are higher level of glucose in the blood, but they are not high enough to be diagnosed as a diabetic mellitus. So as the name suggests, they are just on the cusp of becoming a diabetes. If you don't take any precautions over here, they can go into full-fledged diabetes. So out of all these 4 types of diabetes, the type 2 diabetes and pre-diabetes, these group comprise the most. Almost 90% of the people fall into this category. And these 2 diabetes are very much can be prevented, can be managed very well, and even we can reverse these states in some. So, and then that too through some lifestyle modifications. So we should be concentrating more on these 2 groups. So how do you know that you have a diabetes and in which category you fall into? So these are some commonly done tests like HbA1c, fasting, and here only fasting is given, but fasting and postprandial blood sugar levels, and glucose tolerance test. Just to say that in the normal category, if HbA1c test is done, it should be below 5.7%. So if you are pre-diabetics, your goal should be coming into this normal range. And if you are diabetic and if you are on medication or you are having insulin, then your healthcare provider or your doctor will decide what is the good goal for you for maintaining these levels. And you should aim to be in that lower levels of blood sugar levels. Okay. So, but why we are making so much fuss about this diabetes mellitus? Why we should be afraid of this disease? That is simply said because diabetes mellitus affects each and every cell of the body because it is circulating in the blood, and practically all organs are for the risk of complications. So some of the risks are like this. So there could be a gangrene and amputations. It affects heart, leading to heart disease, stroke, blindness, kidney. It affects kidneys, leading to kidney failures. These are the extreme complications. And when we can see that due to in the person who had a diabetes mellitus is 50% higher than those who did not. And of course, the cost of medicine, that is a huge, even the cost of medicine is too, even if you are having a lesser category of severity of the diabetes, but the cost of medication is very, very high. So what can you do? What we can do? Yes, we can do a lot. We should take a charge and do some few lifestyle modifications. Then what you can do is you can prevent or delay type 2 diabetes and even the other diabetes like type 1 and even gestational diabetes. You can manage them very well with these healthy practices. Okay, so many times people say, see, my parents are having diabetes. It is a genetic disease, so I'm going to get it. So what's the point in going through all these restrictions and going to all this? Yes, it is a genetic factor is there, but let me show you these studies. The studies have been done in the twins, in the identical twins. The identical twins, they shared at least 100% their DNA. So even in those twins, it has been found that only one person is having diabetes mellitus and other is not. So why there should be this difference? So it is observed that difference happened because of his lifestyle and environmental factors. So yes, genetic factor is there, but your lifestyle and how you your health, how healthy you are, that depends on your. It is in your hand actually. Okay, so going through all these lifestyle modifications, and does it really help? Again, people have this doubt in their minds. So for them, so let me show you these studies. So many studies have been done so far in USA, Finland, China, India, Japan, where they studied people from different ethnic groups, different ages, male, female, and they studied for a few years long. These were the few year long studies. And all these studies shows a very promising results. In every study, they found that taking care of your exercises, your diets, interventions, the progress of type 2 diabetes is reduced, or in some even they were able to reverse the processes. So yes, lifestyle medicine is effective and it does work. So what modifications are we looking at? There are some few simple things we can do, which are going to help us in a long way. So in diabetes, managing diabetes, nutrition or diet plays a major role. So first is balanced diet, exercises or activity, weight management, avoiding smoking, excess or alcohol, reducing stress, sleep, proper at least 7 to 8 hours of sleep, and regularly monitoring your blood sugar levels at regular intervals, and having frequent medical checkups as suggested by your doctor. So this is the areas we should be focusing on. So let's talk about what is the diet in diabetes. So yes, it is very important that the diabetes patient should know what they should be eating and what they should be avoiding. But this should not create fear in their mind, because many times they say, okay, diabetes means so many things I can't be eating. There are so many restrictions. So no, diabetic diet should not be like a restrictive diet. It is a well-balanced diet, but there are just certain factors which you should be giving more importance to. So your diet should contain all like macronutrients and micronutrients. So macronutrients are carbohydrate, fats, protein. Micronutrients are vitamins and minerals. These are essential. Come what may, these are essential for your bodies. So when I say good fats and protein, so fat should come from olive oil, avocados, nuts. These are the best sources. Then you can go for the cold pressed oils like peanut oil, sunflower oil, sesame oil. Those you can use. Avoid as far as possible the too much saturated fat and trans fatty acids. So trans fatty acids are the one are very dangerous, and they are produced when you repeatedly fry foods in the same oil, deep fry the foods, and that oil or that dish is not good for you. Proteins, yes, as far as possible, go for the plant-based proteins like legumes and your lentils, etc. Then comes your chicken, fish, clean cuts of meat. So these are good quality of fats and proteins. And try to make your each meal, see that your meal is comprised of all these nutrients, that it should have some carb, it should have protein, it should have fat, it should have some vitamins and minerals and that you will get through your vegetables and fruits. So this should be a balance. This is how the balanced meal should look like. Only thing over here is giving more importance to your carbohydrate contents. So because as we have seen that it is a carbohydrate which is getting converted into glucose, and it is giving rise in the blood sugar level. So if you are diabetic and your sugar levels are high, then you must compensate this with your eating habits by having low carbohydrate foods. But that does not mean you should be stopping them altogether. No, it is not. I don't mean that to stop completely. No, only thing you are to collaborate with your dietitian and see what are your requirements depending on your activity, depending on your lifestyle. She will come up with the plan and she will recommend you a certain amount of carbohydrate, let's say like 100 grams, 120 grams, depending on your weight and your activity. So to count that carbohydrate, you should be knowledgeable enough to looking at the food and see which food contains carbohydrate, and you should have some visual cues to know how much is carbohydrate are there in that dish. And that carbohydrate should be of quality. Carbohydrate counting is not only focusing on the amount of carbohydrate, but also the quality of the carbohydrate. So good quality carbohydrate means it should have fiber in that. It should be a complex carbohydrate. If you are having some refined foods like your white bread, white rice, pastries, etc., that they are not of a good quality, because when you eat them, your sugar level is going to shoot up immediately, and insulin is produced, and insulin tries to bring that down very fast. Then very fast your sugar levels are going down. So these will cause like a spikes in your blood sugar levels up and down. So we don't want that spikes in your sugar levels. The sugar level in the blood should be steadily going rising and steadily maintaining the flow. So that to happen to that, how we can achieve is when we take our food with enough fiber, and that food is balanced with the proteins and little fat. So this way your blood sugar levels will be maintained. So yes, carbohydrate, see its quality and its quantity too. Also about the fiber, fiber are, yes, good for your blood sugar level, and also they are very good for your digestion too. Fiber is a food for gut bacteria, or the good gut bacteria, which help in the digestion of the food. And also they coat one lining inside your intestine, and that acts as a barrier to enter the glucose directly in the blood. So this way also, the absorption of glucose is reduced by these good gut bacteria. So that is very important that you have some fiber in your meal, each meal. Okay, and timing of the meal. So especially the diabetic people, they should not be having erratic routine or just whenever eating in the morning or skipping breakfast, then there is a long gap between the two meals. No, this is not going to help. So as far as possible, have meals which are well-defined meals at a certain period. For most of the people, breakfast, lunch, dinner, and 2 small snacks in between, this pattern works. But having said that, this is a very individualized diet should be very individualized. This should depend on your lifestyle and your requirements of your body. And this, again, you should plan this out with the help of your healthcare provider, and then come up with which type of meal plan is helping for you. And have a routine, have a daily routine from morning to evening, and align your even meal timing with your circadian rhythm. Circadian rhythm is nothing but your body's internal clock, and which is depending on the sunlight and the night time. So here what happens when we, in the evening time, your melatonin, which is a sleep hormone, start to secrete. So it is giving a body the signal that now body should be resting. It is a rest period is coming up. So during that time, so if we are having these late night dinners, so this melatonin is having inhibitory effect on the insulin. So insulin level gets down. Melatonin is more, insulin is less. And in that time, if we are eating, then there is a discrepancy. Insulin is not enough to process all your food. So even this plays a role in your glucose metabolism. So overall, yes, well-balanced food, giving more importance to the amount of carbohydrate and its quality, and your timing of the meals. This is what you should be having in your minds whenever we talk about sorry, just a second. Okay, this is overall overview of the diet in the diabetics. Then how to count your carbohydrates. So there are many lists are given. Even the American Diabetes Society, they are giving the list of carbohydrates containing which food contains how much. So one serving gives 15 grams of carbohydrate. That is means. So one slice of whole wheat bread will be having 50 grams of your carbohydrate. So, and whereas rice will have only 1/3 of rice will give the 15 grams. So this difference you must have in your mind, not thinking, okay, I have eaten like 1 cup, so this is not going to get much difference. No, it is not like that. And milk, even milk also has carbohydrate. Many people think milk does not contain carbohydrate, it is all protein and calcium. No, even this. So what you can do is make a list of food which you eat routinely, whatever routinely food you're eating, and see that, note down which food has how much carbohydrate. So this way you will have an idea about how much carbohydrate you are eating, and then you can make a adjustment accordingly. Okay. Yeah, so these are the some general guidelines. What you can do is to avoid white bread, because as we have seen, it is it causes spikes in your blood sugar levels. So instead of that, go for whole wheat bread, millets. Millets are very good in case of diabetic food. Avoid white rice, go for brown rice, quinoa, barley, etc. Instead of sugary breakfast, go for steel cut oats with vegetable or fruits. Saturated fats should be avoided and go for avocado, peanut butter, almond butter, even hummus is good. So these are some of the food ideas for you. If you are been used to having your chips, fried food, soft drinks, etc., all this fast food, if you are used to that, just try to swap those with the good alternatives. Okay. Now, this is how your plate should look like. If we divide the plate into half, the half part is made up of vegetables and fruits. So most portion is through vegetables. This can be starchy or non-starchy vegetables, lesser amount of fruits. Then comes protein, and the last part, small part, is through the whole grains, and that is carbohydrate. That's how ideally your plate should look like. And now this is a modern food pyramid. Previously, the pyramid was showing the first and foremost group was the carbohydrates, the only carbohydrates through grains and grains, etc. But now we promote first line of your healthy pyramid is being active. Your activity, your routine is the good habits. This is must. This is more important. Then comes the energy foods, that is your complex carbohydrates and good oils. Then comes proteins, and then lastly, little amount of saturated fats and some condiments, etc. Okay, so as the pyramid showed, the first and foremost is your physical activity and how active you are throughout the day. So how exercise are related to diabetes. So whenever you are exercises, your muscles are using glucose. Glucose is getting more and more because we are doing some structured activity, and your blood sugar level start to come down, and also it is helping insulin to produce more effectively. So exercise does affect in case of diabetes to maintain the sugar levels. The other benefits of exercises, as we all know, that it improves blood circulation. Circulation gives more oxygenated blood to each cell, so cells function at their optimum. Exercise will help you to maintain weight, increase HDL, which is a good cholesterol. So your heart muscle, your health is going to be better. And also exercises release endorphins. Endorphins are the hormones released from brain, and they are called as happy hormones because the research has shown that after exercises, your mood level is good, is more happier. So it is very good for stress management also, to reduce your stress. It is actually called as natural antidepressant. Okay, so exercise are important and in diabetes too. So what type of exercises and how much and when we should be doing the exercises? So every day, simply saying 30 minutes every day of exercise is good. So many people say we don't have time. So for them, even this 30 minutes, they can divide into 2 parts and do some exercises. So exercises can be structured exercises like going to gym, or some exercises which are like yoga or body exercises. These are like structured exercises. Simple exercises could be just walking and jogging, etc. So this exercises, okay, sometimes people say, okay, I walk every day, I'm walking for half an hour, but still my weight is not reducing, or he is not getting the desired benefits after weight. So here I would like to say that yes, walking is good, but with the walking, we must be doing other types of exercise also. So what exercise components are there are three types of exercises. So one is stamina, strength, and flexibility. So stamina exercises means these exercises are good for your heart and lungs. Here, heart and lungs are getting activated more. So those could be your walking, jogging, running, playing sports, cycling, swimming. All this will come into stamina exercises. So these exercises you should be doing 5 to 6 days at least per week. And the intensity should be like a moderate intensity to start with, and then you can increase the intensity. Then comes the strength exercises. Strength exercises where it is the muscles of the body are getting exercised. So those could be like push-up, sit-up, squats, or if you go into gym, there will the machine train, you use the machines, different machines like bench press, etc. These all exercises are working on your muscles. And this you should be doing at least 2 to 3 times in a week after warm-up. So good muscles are very important, because good muscles means good metabolism, and good metabolism means there is a good blood sugar level control, and also it will help in your weight loss. So yes, you must give importance to these training exercises. Then comes flexibility exercises. Flexibility exercises are meant for joint and ligaments. So exercising all the joints, right from taking from your neck to toe. Take each joint and just mobilize it to its full range. And that you can do daily, because many times we are just sitting at your desk or in front of TV, or like even if you are having a phone, you are looking down and you don't know the half an hour has passed already. So loosening up your joints and ligaments is very, very important. So those will help you in your circulation of the blood, and also for the balance and supporting your overall structure of the body. So stamina, strength, flexibility. So remember 3 types of exercises and try to incorporate in your exercise program. So yes, and which is a good exercise for diabetes. There is nothing like, okay, this exercise is only good or no. Select exercise which you like, which you are comfortable with. Only thing, see that you are incorporating, like simple, like saying walking. So if you like walking, start your walking with the flexibility exercises. This will act as a warm-up exercises. So after warm-up, go for a walk, do some brisk walking where your heart rate is slightly more and your breathing is slightly more. Walk for at least 25 to 30 minutes, then gradually slow down and do some stamina exercise, strength exercises like push-up, sit-up, squats. So this is like a simple, good exercise program for you. Right? Okay, so you don't have too much of a time. Okay, so keep your weekends to do the structured exercises, but in a whole day, every other day, see that you are doing some exercise snacking. Just like we snack when we are just going about, okay, just pick something and we are eating something. So it happens so easily. So even exercise can happen on the go, or whenever you are having sitting in your chair, or in the office too. So what you can do is you can incorporate all these mobility exercises, like shown here, some neck stretches, your knee raises, your hamstring. This is good for your hamstring, the knee backs. And so whenever you in your office, you can do some office exercises or the chair exercises, or simply you can do chair squats. That means sit on the chair and get up, sit and get up. This you can do just for 10 times. Then toe raises, stand up on your toes again for 10 times. Then mobility of joints, just mobilize, just loosen up your joints. So this you can do anytime of the day, in between the days. Like even if you are going for a restroom, okay, do some exercises, do some loosening things. Walk about, just in your office, whenever you want to go for to have some water or something, find out some excuse to walk about, or when you are talking on phone, just get up and talk about. So this is called like a exercise snacking. So this will even help you to be active. The blood circulation is not stagnant, and you are working some muscles, and this is utilizing your blood sugar levels too. So don't think, okay, these are not exercises. These are exercises, of course, not to that intensity, but it does removing your blood sugar level, maintaining your blood sugar level. So do your exercise snacking. Okay, so in case of diabetes patients, you must have the safety of yourself in the mind before starting any exercise. Really, if you are not done any exercises before, so it is important that you first take advice from your healthcare professional. Do these exercises under the supervision, and first check your blood sugar levels before and after your workout, because exercises can lower your blood sugar level after the intense exercise, and that may last for many years, even after the exercise is being done. So you must know what is your blood sugar levels in terms of your exercise schedule. Then accordingly, you can plan your meals. If the sugar level is low, then you can start with your, you can have some sugary snack before, and then do the exercises. Stay hydrated during your exercises, because again, hydration will affect your blood sugar levels. Dehydration affects your blood sugar levels. There may be high levels of blood sugar. Yeah, then comes your proper warm-up, cool-down session. If you are new, gradually increase your intensity and frequency of the exercises. You wear proper shoes, because having cuts or any injury to the foot is not good in case of diabetes. Even that you have to keep in your mind. And also, yes, remember or pay attention to the warning signs. If you are getting dizzy, there are palpitation, chest pain, etc. So just stop the exercise for that time, check your sugar level, and then if it is low, take some fruit juice or any glucose tablets, etc. And then go about your exercises afterwards. Yeah, and it is a good idea that diabetic patients who are on medication, or those who are having insulin, they can wear a medical-based bracelet, so that people around them will be aware that, okay, this is a diabetic person. If something in the spells of dizziness and all, they can do something about it. Okay, so this is a good safety measure. Okay, so how important is weight in case of diabetes? So we have seen that in obesity, there is an insulin resistance happens, because cells are not do not readily let the insulins to go inside them. There is, so because of the fat more fat in the cells. This insulin resistance is happening. So pancreas has to work more. It produces more insulin, and over the time, if this goes on, then there is called beta cell fatigue, and eventually the production is less and leading to type 2 diabetes. Again, in case of obesity, there is a fatty liver, and fatty liver can do their work. What liver does is the extra sugar is taken up and converted into glucagon. So this is not happening when there is a fatty sugar. So these are the factors leading to type 2 diabetes in case there is if the person is overweight or obese. But the good news is that if you are overweight, so losing just 5 to 10% of your overall body weight, it can prevent the occurrence of type 2 diabetes. So just little efforts can go a long way. So manage your weight if you are diabetic. Stress also plays a very important role in diabetes. It does cause diabetes mellitus. How? What is stress? See, in the olden days, stress was due to hunter-gatherers time, because some animal is coming and the person has to either fight or flight. So that response is still there. Even though the cause of the stressor is not the same, but every time we get stressed out because of anything like exam tension or any other your personal tension, the stress hormones start to release from your brain. So those are like adrenaline and cortisol. And what they do is they prepare your body for fight or flight. To do that, they produce more glucose, because glucose is what is going to give energy to your muscles to do these work. So but this stress levels or these stress hormones remain constantly in your blood for a longer period, then eventually this is going to cause affect the insulin pancreas and your insulin metabolism, and this leads to your diabetes mellitus. So managing your stress, again, there are so many techniques that how we can manage our stress, because this modern life is everybody has stress. So we have to find out what works best for us. So one thing, exercise do help in managing stress. Sleep, another thing is, then you can learn some meditation techniques and behavior cognitive, but you have to make some efforts, deep breathing techniques, and learn how to manage your stress levels. Like I said, sleep is also affecting your sugar levels, and lack of sleep causes again insulin resistance. So here what happens when we are not sleeping, the level of leptin is called as satiety hormone. It is secreted by our gut. So this hormones gives brain the signal that, okay, the stomach is full now, no more food is needed. But in case of sleep deprived people, the body is constantly in a hungry state. And that too, this hunger is for fatty food and high calorie foods. So it is seen that those who sleep, those who are insomniac or those sleep is not good, they tend to eat more. And this way, this will lead to obesity. And again, the cycle will start. Second is, yes, everybody knows like how smoking and alcohol literally affects each and every part of our body, and it is bad. So in case of alcohol, of course, it causes the insulin resistance in a long term. And if you are taking alcohol in a fasted state, means you are not having any food, and if you take alcohol, then your blood sugar levels will actually go high. Okay. The second effective what it will have is it has effects on your pancreas. So eventually your pancreas are going to get affected, and there will be affecting beta cells and less production of insulin, and the diabetes will happen. Thirdly, your weight is going to increase, and this way is leading to your type 2 diabetes. Smoking, yes, smoking also acts on your blood vessels and your hearts. So actually it damages each and every part of your body. So smoking and alcohol, we must be avoiding. Okay, so this is the one thing a diabetic person should do, so that he is aware of his blood sugar levels, and he can take care depending on his blood sugar levels. So this will help in managing the doses. So doses can be adjusted according to his levels, and his food, exercise regime, the timings, it can be arranged properly, so that there are no hypos and hypers. If suddenly there is low blood sugar levels, then he will get dizzy and all other complications will start. So we don't want this spikes or hypos and hyper levels. So monitoring your glucose frequently or daily, or as told by his doctor, he should learn to monitor his blood sugar levels, and so that his routine is formed. Lastly, having regular medical checkups. So you are doing all these things on your own, but at least every 3 months, or depending on your condition, maybe every 6 months, every year, you should be meeting your doctor, having the full health checkup and comparing your notes with him, so that the early detection, if you are doing well and good, it is very good. But if there are any early signs of further complications, like in your retina or your tingling numbness in the hand, so that can be prevented in the first stage itself, and the things will not go out of the hands. So having a regular checkups is must. Also check your foot examination for the cracks and non-healing wounds, etc. Your blood pressure, your cholesterol levels, this should be checked, so that this way we are going to manage your diabetes. Yeah. So to summarize all, what we are seeing is, yes, lifestyle modification does work. And for that, what we have to do is your diet, fitness, your weight management, and then comes your alcohol, smoking, and having a routine where you are checking your blood sugar levels regularly, and having one medical check at least a year or half yearly. So this is the way you are going to manage your diabetes very well. And yes, it can be done. Thank you. Over to you, Ms. Lani.
Thank you, Dr. Madhurima, for the very enlightening presentation. We thank you for sharing your time, knowledge, and expertise with us. I am sure each has a take-home message and learning from you today. We wish to call in Dr. Wilco to take a few questions from the participants. Dr. Wilco?
Yeah, thank you, Laleen. First of all, thank you, Dr. Madhurima, for a wonderful session. You have answered most of the questions we generally face during the participant when we are coming for the queries. So anyhow, I'll be taking few queries which are very important and which we have received the emails also and in chat box also. The first question, Harsahaj is asking, my gym trainer suggested drinking a lot of fresh fruit juices. My doctor tells me to avoid sweet fruits and juices. I'm confused. What should I do? Doc, you have mentioned during the diet part, the safety part, especially the safety part. Use juices and have some glucose handy with you when you have some problem? Now, this question is very perfect because this is a very common question, very common confusion with all the participants, those who are diabetic, those who are pre-diabetic also.
Yeah. Yeah. So you should not be having fresh juices if you are not diabetic. Okay. Then we don't recommend them having fruit juices, but to have a whole fruit. But this is different in case of a diabetic person, because in a diabetic person, after the exercises, his blood sugar level may go down suddenly. And in that case, eating a fruit will not come up his blood sugar level fast. So here, the importance of fruit juice is there. So he can use fruit juices in this case.
Yeah. Otherwise, for a diabetic, those who are not doing an active exercise, they should avoid juices. Instead of, they should eat a lot of fruits.
Yes.
Now, second question. Yeah. The second question comes from Ria. My husband is diabetic and has arthritis of knees. What exercise he should follow? Is it safe to exercise?
Yes, it is very much safe to exercise even if he has a diabetic and arthritis. Just see how severe the arthritis is, or how severe his blood sugar levels are, just to get a clearance from his doctor. But that levels are very much controlled. Yes, he can do the exercises. But for in arthritis, he should be doing exercise which are not impactful. Means your jogging or jumping jacks, or the exercises which are putting more pressure on his knees, those exercises should be avoided. He can do some aqua exercises if the pain is more, that is exercising in the water, or in swimming pool. He can just take a rounds in the swimming pool itself, even if he does not know how to swim. So those hydro exercises will help him. If not, then he can do non-impact exercises, like simply sitting on the chair and getting up. This is as good as a squat. And upper body exercises, using cross trainer, even that will help him. So there are many alternative exercises which he can very well do, and he must do. And he must do some stretching that will also help his arthritis and the knee pain. Definitely it is going to help.
That's perfect answer. There is one question which we generally come across. There are a lot of queries about this. Sarfraz is asking, there are many theories of exercises and timing available in the internet, or whatever you can say. Every second person is a coach to advise people. Now, yes, what is your advice for a diabetic patient? Because you are a diabetic educator, you are a health professional, so you will be the right person to guide a diabetic patient.
That is true. So they are asking about what are the best exercises for diabetic, and the timing of the exercises. That is what he is asking, I think. So as far as timing is concerned, morning and evening timing is good. Doing exercise in the morning is good. Why? In the sense, because that time is in your hand. Start of the day, you are doing your exercises, the whole day you are feeling better. But because as the days progresses, you don't know how it is going to progress, and whether in the evening you will be getting time to do exercises or not, or you'll be too tired to do the exercises. So in that sense, they are good. But it does not mean that you should not be doing exercise in the evening. No, if you have time in the evening, yes, go ahead and do your exercises in the evening. No problem at all. Only thing, see the timing between your exercises and your bedtime. Do not exercise close to your bedtime, because then your body is in the hyperactive state. Your sleep timing is going to go ahead, and you will be awake for at least 3 hours. So see that at least 3 hours difference is there between your bedtime and the evening exercises. So you can do exercise anyway, anytime. Or if you don't have time, like I said, do the exercise snacking, be active throughout the day. And about which exercises, diabetic patient not having any physical limitations, he can do all the exercises. he can choose the exercise program. It is not just one exercise. He should be having an exercise program, and that program should have your exercises for heart and lungs, exercises for your joints, exercises for your muscles. So have a comprehensive program like that.
Yeah, combination of all stamina, flexibility, and strength.
I understand.
That's a good thing to be done. There is one interesting question. Now you were talking about the diabetic patients, and you mentioned about the pre-diabetes also, but you have not focused much on pre-diabetic management. Pinchel is asking, is pre-diabetes reversible, or does it require medication?
Yes, pre-diabetes is very much reversible. Pre-diabetics do not require medication at this stage. He can improve his lifestyle. He can eat healthy, do exercises, look at his lifestyle, what he is doing wrong right now, and try to change some habits towards the healthier lifestyle. And he will be surprised, or he will be happy to see that his blood sugar levels are getting managed very well with the lifestyle modification, provided he does not have very strong genetic history or any other comorbidity. But even still, I can say yes, it can be reversed.
Yeah, they need to do a full body medical checkup, health checkup, so that they know the conditions of their comorbid conditions. Yes. And according to that, they can plan. There is one interesting question. It's very popular nowadays, intermittent fasting. Dr. Veena is asking, does intermittent fasting help to reverse diabetes?
Okay, yes, it is true. The WhatsApp University has been promoting it since so long. Yes, intermittent fasting is showing promising results in some studies. But here, the word of caution I will give you. We know, there are benefits, but we don't have data which is a widespread data and for a longer period. These are still ongoing studies. So we don't, 2 months, 3 months, a year, it is showing results, but we don't know years together what happens after, let's say, years or so. So that data we don't have. But as for us, we are talking about today, yes, I will say that go for your intermittent fasting if you want to do it. Take a permission from your healthcare. If you are a diabetic, ask your doctor first. If he says yes, or your sugar levels are under control, then no harm in trying it out. So try it out. But try it out slowly. Just don't go about doing 16, 18 or 14, 6, those kind of extreme intermittent, like a time restricted windows. Start gradually with, let's say, 12 and 12. The next week, then you can go about your 14 and 6. So this way, gradually increase your time restricted windows. Let the body get used to that new timings and see about how it goes. And even after all this, if you are feeling dizzy or something is not good, listen to your body and then don't do it. This is not for everybody. Every individual has a different needs, and we should know what our body really wants. And yes, so that's what I would say.
Yeah, thank you. That was an underlined statement. It's very important. Every individual is individual. So they have to go according to their individual health and their advice of the treating physician. There is one sweet question. Imran is asking, what to eat when you crave for sweets, especially for chocolates? It's too sweet.
Okay. All right. Yeah. What to eat? Yeah. If you want to eat chocolate, I will say just go for dark chocolate, which will have less carbohydrate. So develop your taste for the chocolate. And see, we talked about your carbohydrate exchanges. So chocolate is also a carbohydrate exchange. So see how it fits in your overall diabetic menu. So you can have it, no problem.
Yeah, that doesn't mean doctor has given a permission to eat, but still, if you're not able to control your craving, then you can opt. Imran, this is for you.
Yeah.
I think we have already covered most of the questions, and yeah, I will just add one thing. Many people, because many of them are not able to attend the full webinars, and maybe many of them wanted to review the webinar what the speaker has spoken. Please visit the website rackdiabetieschallenge.com. Under the webinar section, there is an archive, webinar archive. You can see all the previous recorded webinars, and you can watch it over there. And if you still want any thing, you can just mail in support@rackdiabetieschallenge.com. We are happy to serve you. So from my side, that's over. Lailin, over to you, please.
Once more, we thank each one of you for taking part in today's webinar. Our special thanks to Dr. Madhurima Deshmukh. Thank you, Dr. Wilco, and the organizing team who worked so hard to make these webinars possible. Thank you. We're hoping to see you all on the next webinar. That is on Friday, 11th of November, 2022 at 11 a.m. to 12 noon. Our speaker is Dr. Ravi Andrew. Diabetes and renal health. Thank you all and have a nice day.